Hello and welcome to a very special episode of Public Health Disrupted with me, Xand van Tulleken.
And me, Rochelle Burgess. Xand is a doctor, writer, and TV presenter, and I'm a community health psychologist and professor of global mental health and social justice at the UCL Institute for Global Health.
Now, this podcast is about public health. More importantly, it's about the systems that need disrupting to make public health better. UCL is marking 200 years of challenging convention. We continue to ask the difficult questions: what needs to change, why, and how do we get there?
And for today's episode, we are absolutely delighted to be joined by a live studio audience. Can we get you guys to clap so everybody knows that it's...
Woo! Bravo!
Yeah. So it's real. It's not just us pretending. We do have everyone here today.
We haven't got canned laughter. That would be, although for future episodes that could be a thing.
And together we're having a really special conversation exploring the history of public health at UCL as part of UCL's bicentennial program. We'll bring together historical case studies on pandemics, vaccination, and sanitation to reveal a different story of public health, one shaped not just by progress, but by resistance, conflict, and debate. This conversation today explores what meaningful disruption in public health looks like today and how 200 years of thinking continues to shape the future of health for all.
We have a fantastic guest with us, Dr Cristiano Turbil. Cristiano is a historian with an expertise in the modern history of medicine. His research explores the relationship between medicine, politics, national identity in modern Europe. He's written on the history of health and science communication, the history of public health and popular medicine. Cristiano, welcome. Thank you so much for joining us.
Thank you. And thank you, everyone, for being here. It's a joy to see you all.
We should get a round of applause for Cristiano.
Thank you.
Amazing.
So Cristiano, our first question, when we look back at the history of public health, I think we often like to tell the story of progress, right? We see the good things that public health has given us. And I think that's really fantastic. But in your work and in sort of talking with you in the last little while, it's been really clear that actually this story is much more contested. And many of these moments of success and growth are very deeply contested. So why do you think that matters so much for us to know that kind of history in public health?
Well, thank you. First of all, thank you so much for the question. That's a very exciting question to start with, because yes, there is a tendency to look at the past, look everything that happened in the 19th century or even before and say, look, everything that happened there was just a step toward what we see now. Reality is much more complex than that. Now, I'm going to give you two examples of what I do when I get into the classroom. I tend to teach medical students, and medical students sometimes, they tend to have this kind of very positive view of these great doctor, great men in the past that have done this big revolution and everything just follow up. The story is much more complex, and as you rightly say, is controversial, very often is put people against each other, create huge debate. So today I'm going to try to give you a couple of examples of those stories, but also tell you how history and the history of public health and medicine can help us make sense of those events in the past, to not just understand the present, but also perhaps looking at the future, trying to prevent what is going to happen next. So I say I'm going to give you two examples. And the first example I always tell my student is the fact that when we think about health, when we think about disease, or medicine, those are not neutral. They are extremely political. It's not something that happens in the clinic, in the laboratory. It's something that is discussed in the public street. It's discussed by people in the pubs. They are discussed in the parliament. So they are extremely important, and you see a lot of opinion, very often of people of different belief, different group, different age, that are against each other. That's one thing. The second tension that is very important to reflect upon is that when we look at history, very often we tend to do something that is called retrospective diagnosis. What is retrospective diagnosis? It's fundamentally taking our idea of the present and apply them onto the past. It's very easy to look at how health exists in the 19th century or in the Middle Age or in antiquity and realize that those people were just wrong because perhaps they believe in stuff that now are disproved. So today, later on, I'm going to talk to you a little bit about the idea of miasma. Now we know that that miasma doesn't work. We have germ theory, but in reality, what we need to do is to ask the fundamental question, not just why they were wrong, but why they were think those type of ideas were right at the time. And if we do that exercise, we really unveil a number of tension. They are so ingrained within how people look at health, look at disease. They relate to the state, they relate to doctor. We really get the chance to explore those type of tension. They are so beneficial to fundamentally discover that the Great Revolution, for instance, in the 19th century, yes, to a certain extent, lead to the creation of the NHS in the 20th century and to nowadays, but this terrain is extremely uneven. And is uneven geographically, because stuff that were happening in London not necessarily were happening in the countryside, is uneven historically, because what is happening in the UK in the middle of the 19th century is not happening in British-controlled India, or is not happening in South America, or in Central Africa, or even in France. So we need to be aware of all of this. The second point I want to make is about the use of history. You all remember that a few years ago, we were actually in February 2020, we were at the beginning of a pandemic. And I don't know if you remember all of the newspaper, you were start reading news that was telling you, oh, look, we are at the beginning of the pandemic. We are after the last big pandemic that went on Europe, the 1918 influenza. So you were seeing all of those newspaper articles that were trying to compare the two. Say, look, we really need to learn from the past. We really need to see our idea of, social distancing, face mask, sanitation. We all went through this already, so we can learn from the past. Now, all of those articles were in newspaper between February and March. Then they suddenly drop. They stopped writing about this, not because the history of the 1918 influenza, the Spanish flu, was not important, but because we realized that when it comes to compare pandemic, it's not a matter of doing a direct comparison, because the contexts are different. In 1918, we are toward the end of the First World War. There is no NHS, so the context is different. But what historians actually have done later on is to evaluate certain type of tension, evaluate the importance of listening to voices beyond the politician, beyond the public health expert, to understand the role and the opinion of the people that are experiencing the disease. So this is why when we think about progress, and I'm getting back to your original question here, it's very difficult to just draw a line, to say, look, a paper that was written in the middle of the 19th century is necessarily a step toward what will be the NHS 1 century later. We need to be aware of that. We need to be aware that those debates are complex, those debates involve a number of voices, and the work of the historian is to make those stories, to make them come alive, to speak with those people, to try to understand why they were concerned. So hopefully some of the story I'm going to tell you today really try to speak about that.
So can we start with one story that kind of brings to life all the things you've just mentioned? So you talked about part of your job being to think about why people might have held the beliefs they do, and the relationship between politics and health and public health. And it always feels to me like there's no better example of that than anti-vaccination as a thing that we think of as being modern, but actually has very deep roots, very ancient roots. Vaccination itself is a very old form of technology. And so we have this moment where we can think, we really want to know why people believe what they believe now, and they've been believing it for a long time. So talk to us a bit about the history of vaccine, public resistance to that idea, and what that tells us about the public's relationship to public health.
Thank you. Now, vaccination, I work on it. So I do part of my research is on the history of vaccination and medical scandal, and is one of those episodes in medical history that, let me start by saying, is an history of success, because it's important to stress that vaccination campaign, and in particular vaccination against smallpox. We will get in a second why we talk about vaccination, why it's called vaccination, who made the discovery. I'm going to give you all of the detail. But I would like to start by saying that it's an history of success. Smallpox is the only human disease that has been effectively eradicated roughly 40 years ago. We are between 1978 and 1980. However, at the same time, the path from the discovery of the vaccine to the eradication is extremely, extremely controversial. Actually, if we look in Victoria, London, we see that in that period, we have one of the largest movements of resistance toward medical or public health regulation in history. So imagine yourself, you are walking out this theatre 150 years ago. Is a dark, gloomy evening in November. You're working in Bloomsbury, you're walking towards St. Pancras, and a group of women, a group of mothers approach you and give you a leaflet. The title of this leaflet is Disaster from Vaccination. And this group of women is the mothers' anti-vaccination group. Now, if you open the leaflet, you read one name. It's talk about the story of a child, 10 months old child, called Giovanni Cabrera. Giovanni Cabrera is an Italian that is vaccinated in May 1861 against smallpox. Within 1 month from the vaccination, they discover in Italy that around 50 children and 20 adults, all of them, they got infected with syphilis, a sexually transmitted disease, very controversial, very stigmatized in the 19th century. It's a scandal of extreme proportion. I managed to find a reference to this case from Japan to US, from Europe to Russia. So everyone is talking about it, to the point that between the 1860 and the 1870, we have a number of articles on The Lancet, a very important medical periodical, that talk about the Cabrera case and how vaccination perhaps is not as safe as believed. But let's put this case study on the side for a second and let's step back. So why we have vaccination and who is responsible for vaccination? We are in the 18th century. Smallpox is a really complex, very deadly disease that impacts children. We know that the majority of the adult population is immune to smallpox because he encountered it at some point in their lives. We know that we have a method that is introduced in Britain in the 18th century. It's called inoculation. So inoculation is an idea that comes from Istanbul, where the lady Mary Montagu is the wife of the ambassador there. Bringing back this technology to the UK is fundamentally the idea that you insert into the arm of a child a lymph that contains smallpox. It works, but it doesn't work all the time. It's not safe, it's highly controversial, people don't like it. The story of vaccination comes from the work of a British surgeon called Edward Jenner. Edward Jenner worked in Gloucestershire, in the countryside, and he made an observation. That's where cow come into the story. So he observed that milkmaid, they are naturally immune to smallpox because they receive a blister from a similar disease, cowpox, when of course collect milk. He write a pamphlet. He does a number of experiments. One of them on children of his village. Is a different time. They didn't have to ask, for ethic permission. They were just try and test it. Late 18th century, send a report to the Royal Society. He call it vaccination, that come from the Latin word vacca. And that's the beginning of our story.
That word means cow.
Yeah. Yes.
Yeah.
Yes. Yes. Sorry.
No,
As Italian, I tend to, Latin.
You know what it means.
Exactly.
Yeah.
Exactly. So, early 19th century. So we have an agreement among doctors that vaccination is the way forward to fight against smallpox. We have a number of doctors in this country that start supporting the new technology. We have the Jennerian Institute that is introduced in early 19th century, and vaccinations start to be distributed free at the point of delivery. So it's quite astonishing at the time what they were doing to anyone that wanted across the country. So you may ask, okay, fine, great story, is relatively safe, it's a great technology. Why we have people 70 years later that really are concerned about the safety of their children and don't want vaccination to be done to anyone? Well, the story is a controversial story, because from the very beginning, people start seeing vaccination as something that was, to a certain extent, going against what they believe. So we have a number of people that believe that, inoculate a child with a disease is not a way of curing it. Some people believe that this is going against the will of God. So if we were due to get infected with syphilis, why you should interfere? So we see a movement that starts from the very beginning of resistance. People are also concerned, and seems to be quite funny, but then when you think it in perspective, it's not. They believe that using something that comes from an animal will result in their body developing a little cow that were coming out of their arm or their legs. So there is quite a bit of tension in the new technology. But let's carry on a little bit with my story. So vaccination is then introduced. Vaccination is free at the point of delivery, and we see fundamentally a drop of the mortality rate for smallpox. But then the government decide to do one thing. They make vaccination compulsory. So we have a number of legislation that start in the middle of the century, aim at making sure that every single child in the country get vaccinated. It's met from the very beginning with resistance. So what they do, they put another legislation in, and they start putting a fine on people that decide to not have their children vaccinated. Then they ask a doctor and vaccinator to report those families, and they give money in compensation. So they kind of police the process. This is the moment, if we look again, let's imagine this chart of mortality rate, we have a spike in mortality rate again, and this happened around the 1860, just 10 years before the leaflet that imagine you are holding in your hand. But why it is a problem? Now, when you think about vaccination, it's normally something you do in at your GP or in the pharmacy. It's something that is done with a needle, is a single dose, is sterile, is in a good environment. At the time, vaccination is done either at home, if you were rich enough to be able to pay the fine of a doctor, or is done even at the other extreme onto the public street. There is a share of blood that is shared between children. Children that get vaccinated, they need to come back after a week. The lymph is collected from their arm and is used to vaccinate other children. This brings us to the syphilis case.
Yeah.
So what's happened?
It's good. Everyone in the room has sort of suddenly become a bit more of an anti-vaxxer. I feel like everyone's like, whoa, is that how it's done? You know.
So, what's happened in the case of Cabrera? And I totally see the type of feelings, and that's the kind of question we see at the time. Yeah. We have a successful technology that is safe, but people are scared. They realize their voice are not heard, so they start protesting. Now, no one knows that Cabrera, actually, the child was infected with syphilis. They do an inquiry. Later on, they discover that actually he didn't have syphilis, but he received it from his wet nurse. And because no one knew about that, by collecting a lymph from his arm, preserving it in a tube with infected blood, and then using this lymph to vaccinate another 50 children, you create this kind of outbreak of syphilis, which is extremely, extremely complex. Now, and I'm coming to a conclusion here, because I also want to hear what you think about this case and how we can link them to the debate of the present. I've been thinking a lot about vaccination in the past, and I'm coming to almost the conclusion that this is a debate that we talk about vaccination, we can talk about something else. It's about representation. It's about voices. So we have a group of people, all of them united in going against the vaccine. We have mothers, we have politicians, we have religious figure, we have a variety of opinion, very often in contrast with one another. We have doctors that really are in conflict about implementation. We have people that believe that Jenner, and we actually have a magazine where Jenner is depicted as a skeleton and is described as a gold digger, someone that really invents something to make profit out of it. So it's a very complex set of debate, but I also think this is the joy of historical work. You put your hand in this material, you start unpacking those debates, you start hearing those voices, and what you realize is that those are all people that want to be heard. Those are all people that don't have channel, don't have way, apart from protesting, to just ask a question and express concern. I'm coming to a conclusion here, and I just wanted to make the point, vaccination is a story of success. It is one of the greatest breakthrough in the history of public health. They managed to defeat a very problematic, highly lethal disease that impacted children. But even if it's a story of success, we cannot just think about the beginning at the end of the story. We need to see what's happened in the middle. And middle is resistance, is protest, is people being concerned and angry. Thank you.
I want to clap.
We should clap. We're allowed to clap. There you go.
The reason I want to clap is I'm just a history junkie, so clap for that. But also, it's just a beautiful way to actually tell a story, and I think we need more history in our lives, and so you should tell history like that all the time. I think it's great. I mean, one of the things it makes me think about a lot of things. But one of the things that comes to mind is the fact that when we talk about the sort of the necessity of resistance to sort of also drive the production of good practices, of like shifting knowledge systems, like resistance is necessary. You know, I sort of think that like actually without this resistance from mothers and sort of driving that sort of way forward, what happens to science? Does science stall? Like, it just sort of makes me, and that's one thing. And then it just reminded me a lot of sort of another mother's movement around vaccination and autism, which has now been debunked, but that was sort of a movement that was a much more modern sort of resistance to vaccination that emerged at the time when I was graduating my undergrad. And in one of my many former hats, I worked with children with developmental delay, sometimes autism, and there were passionate mothers who really and truly believed that their children's experiences and development of developmental delay or autism or being on the spectrum was connected to their vaccination, and that the way that moved so quickly and through rejection or of science, and how that sort of gets picked up in lots of different public spheres, not just the scientific sphere, but the wider public sphere, the political sphere. It was just, the parallels are just really uncanny. Like when you told me this story, I was like, oh my gosh, it's exactly the same thing that happened in 2005. And sort of, it took us a little bit of catching up with the science to sort of debunk it. But it sort of shows you the way that these two sort of knowledge systems are moving at different paces, but also driving each other forward. Like that resistance became a big part of a lot of the advances in science that we see in sort of trying to understand sort of these different developmental conditions, different psychological conditions.
Can I ask about the people who are represented? So I feel like the people who have a voice are the doctors and the public health community. And I'm wondering about, so it always feels to me in the current anti-vax debate that the medical community is incredibly arrogant and dismissive a lot of the time, particularly on social media. And you have doctors going, vaccines work. And you think, well, vaccines don't work for everyone all the time. They are an extraordinary technology. The UK vaccine schedule is incredibly safe and evidence-based. But to say vaccines work, it's like, well, if you get a vaccine, it doesn't completely protect you from every disease. Not all vaccines are 100%. And they also do have side effects. And I know they do because my brother runs a high-risk vaccine clinic where he has to bring people in to vaccinate them because the vaccines can be dangerous for certain people. So the discourse from the medical community, certainly currently, I think, really does provoke and infantilize and sort of discredit a group of people who are, at least some of them are, deeply sincerely caring for their children and very anxious about this. Was this the case historically as well? Did you have this kind of, I'm picturing a sort of arrogant Victorian doctor encountering a mother and sort of riding roughshod over this? Clearly in the case of the Giovanni Cabrera case, that they have not thought about all the consequences. Do you think the arrogance plays a role?
Yes, but I think it's kind of I will go in a slightly different direction, because the question I've been come to ask myself is who sits at the table? So who has the right to speak here? What we can see in this case, but also in the example you provide, is that we have people with a number of different anxiety. And very often they are brushed under the carpet. So I think it's about finding a common space when different stakeholders are equal and able to discuss. And I think that, getting to your point, you are right, is that if there is a matter of power in which someone
1000%.
has authority onto another, you lead into perhaps a little bit of extremism. So people don't want to change their mind because they know they are not going to get heard. Their story, they are not going to be discussed. Perhaps finding an environment in which, and the history shows us that this did not happen, to have a space to sit around the table, discuss their anxiety, understand where they come from, can help to debunk some of those ideas. And think about the example of all of those people that were having little cow growing out of their arm. It seems absurd to us. But people at the time, and that's what I was saying at the beginning, we really need to put ourselves into the mindset. Is, of course, taken to the extreme, is a cartoon. It comes from, it's an example of satire, but kind of represent a genuine anxiety at the time.
But I think there is a real importance, I think, of when we're talking about science and how science is taken up by the people that it's for, is that we don't spend enough time trying to understand why science should matter to people. So, like, one of the things that I studied when I was at the LSE, we were studying sort of the social psychology of knowledge systems. And one of the most powerful things that I learned was the idea of social representations. And what that is like this social system of how knowledge is produced and how we make sense of knowledge. And it sort of reminds us that actually, like, people use knowledge for a purpose. There's like an object of desire and a project that we're all engaged in order to sort of move that object in different spaces. And so if there's a shared object like a vaccine, it's coming at it from all these different locations with people with different projects of action around that vaccine. So, you know, the doctors have an interest and the government has an interest in making sure that this doesn't spread across the entire population. So they come at it with legislation. And then another group of mothers, the object for them is a volatile, dangerous object. And so they must resist it. And so you actually, without that understanding and being in contact with all the different projects around this, that is how we sort of get into these critiques and debates and outright rejection, not just resistance, actually, but as you say, outright rejection. And that's happening again today around I think around science in general. You know, we sort of see this real pushback in sort of the United States around like science and what's funded and what you can say. And it is very much linked to some people's certain projects around what science should do and what it shouldn't do. And then you've got on the other side, you know, people who connect it to their livelihoods. And I think it's really hard actually to get people around the table, though. You know, this idea of a solution where we get around a table, and I think that is actually the hardest part that we have yet to really figure out.
It is, especially because when we talk about medicine, when we talk about disease, when we talk about vaccine, they're not neutral entity.
Yeah.
And when we think about the language that is used, the analogy, the image, they are emotionally charged. They are politically charged. And when you start looking at those debates and you start to unpack those stories, you can really see the point you were making. We have different stakeholders that do something like this in relation to specific type of objective and goals.
Yeah.
I love, there's some extraordinary accounts of American CDC-led vaccination programs in India in the 50s. And there are diaries from the American officers doing this in conjunction with the Indian police. And they're dragging people out of houses who are refusing to have their vaccinations and beating them and forcibly vaccinating them. And the reason people are refusing the vaccinations is not because they think the vaccinations won't work. It's as a form of political resistance, going, well, and this is what I love what you said about this, Rochelle, about the value of these programs to different people, the different stakeholders, and the idea of success that no one could argue with smallpox as a piece of science or an extraordinary success. But the political resistance of going, if you care about me not getting TB, but you're willing to let me die of starvation in rural India, what kind of a public health official are you? And you're willing to beat me, to vaccinate me. And these examples of people who are at the end of life, who are very ill with other things, And they're going, why are you vaccinating me when you won't help me with my other problems? So I think this is such a perfect place to begin for, and no one should mistake my enthusiasm for vaccines, by the way. I'm pro-vaccine all the way, but I do feel this nervousness. At least I feel great sympathy with anyone who has an apprehension to go, yeah, I get that things can feel oppressive and coercive and risky for a small child, particularly.
Yeah. And it would be, I mean, on previous episodes, we've talked about sort of the tension around vaccination and the dropping rates of childhood vaccination in the UK and the tensions around that. And honestly, nobody likes being told what to do.
You're not
My
the boss of me.
2-year-old reminds me all the time that she doesn't want to be told.
All by myself.
But, you know, and that seems to be the most natural thing in the world, actually, to when something is forced on you, to question the motives, to try to understand where that comes from. And I mean, yeah, I mean, we're talking about the state here. And I think that it's an interesting time to actually shift to the next question that I had, which is, I think, linked to another one of your stories, and actually gives us a chance to tell a little bit more of some of UCL's great history. So what's your next story, Cristiano, about somebody named Chadwick, perhaps?
Yes, and actually is very nicely linked to what you were saying, is the fact that people don't like to be told what to do.
Yeah.
And when we take a look at the big history of public health in the 19th century, there is one big revolution we see in this country, is never done before. We have the state that start to take responsibility for the health of the citizen. All of this happened in the context of big revolution that take place in 19th century Britain. Imagine it's a country that is changing. London is becoming overpopulated. Industrial revolution. We see a lot of filth, disease on the public street. We have a cholera that arrived in this country in 1831 after being absent for quite a while. It's shocking. We actually have a story, I don't have the time to tell you today, about Jon Snow, which is another key figure, not far from here. But the reason why I pick up Chadwick is because Chadwick is a figure that is linked to UCL. He was the personal secretary of Jeremy Bentham. He's not a medical doctor, but he's a fundamental figure in what we call the sanitary movement. So this big revolution that will lead to the 1848 Public Health Act that fundamentally will change public health provision in this country. Now, Chadwick is a social reformer. He believes in health using a very utilitarian process. He's also someone that is very keen to understand how diseases are distributed in this country. So he published a report. We are in 1842. Actually, is an interesting correlation with the Beveridge report 100 years later. And Chadwick recognized that across the main city, there is the presence of specific disease, and there is a link between disease outbreak and poverty. So he came up with the idea of fighting against anything that can be defined as filth, as nuisance. We are in a moment in which we still believe we are still 50 years away from the germ theory. So the idea that diseases are produced by germ that can be identified. The idea to explain disease propagation at the time came from a Greek word. It's called miasma, which means pollution, bad air. So many of those ideas, and Chadwick is one promoter of this, is that if you clean up the street, if you bring hygiene inside the household, if you create a system, an infrastructure in which you have sewers, you have access to water, you will solve some of those fundamental problems. Now, getting back to the point you were making, is that this is something we see in history quite a bit. And we see, for instance, in cholera. So we have an interesting case study. Cholera arrived in Liverpool in 1832. And linked to cholera arriving in Liverpool in that period, we see public riots. So people going to the public street, protest. They don't want the state to tell them what to do. What the state is doing at the time is going to private citizens out that are infected with cholera. He take out all of the stuff, he burn them into the public street. That's totally unacceptable. Mostly because until that moment, there is a sense of laissez-faire. So the state is a principle of non-interference. So we see a fundamental shift with later on 1848 Public Health Act, but also a number of acts in the period that fundamentally shift the responsibility for individual health from the individual to an infrastructure that is run by the state. Now, getting back to the macro theme we've been talking about today, it's a big revolution because it's completely changed the way diseases are managed, but also create a number of problems. So first of all, we have an infrastructure in which certain diseases are made visible more than others. We have decisions that are made that respond to a specific need of the state. I have plenty of examples I can give, but I just want to leave you with this kind of idea that this is a revolution. This fundamentally change public health, make public health as something that is for the public, is for the community, is run by the state, but also create attention. And create a tension that pin doctor against patient, that pin the state and the poor in a relationship that from this moment onward needs to be continually reappraised.
I don't think this tension is necessarily obvious. I mean, you began with the idea that doctors tend to be quite boosterish about progress, modernism, success, all these things. When we look at this, and Chadwick was involved in this, when we look at the reason for developing a lot of the tools for measuring mortality, the statistical tools, large numbers of them were motivated by things like the health of workers in factories, for life insurance tables, to lend people money. That the private sector was very, very involved in an idea of public health that was about, there was an idea of altruism, but there was also a motivation to get people sort of optimally healthy to perhaps do a day of work or be productive, that your health was not the total final goal of an intervention, perhaps. Can you talk a bit about some of those tensions?
Absolutely. And yes, of course, we need to think about this kind of infrastructure in which we need a productive population, we need an healthy population. I'm going to give you an example that is slightly different, but can take it a little bit to the extreme, this kind of discussion. Have you ever heard of the CDA, the Contagious Disease Act? So the Contagious Disease Act are a number of acts produced in the 19th century aim at fighting against the spread of venereal disease, specifically within the army. They start by imposing a certain number of regulations, aim fundamentally of arresting women, put them in special institution called lock hospital, anytime the police or doctors suspect them to be prostitute, and that really speak to the extreme to what you were suggesting. Why they were doing that? Because they realized that soldiers, especially in port and garrison town, they get hospitalized more for the venereal disease than for wound produced by fighting or training how to prep to fight. So is a public health problem, but also is a set of decisions in which the health of one group matter much more than the health of another. I don't have time to go into that, but the story of the Contagious Disease Act bring in one of my favorite hero, Josephine Butler. Josephine Butler, late 19th century, will strongly campaign in Parliament, bringing the argument the health of women is equal to the health of men. And act like this put men and women on two different levels. So I think that you are absolutely right. It's not just about this great utopian idea about sanitation. It's also part of a very complex infrastructure in which economy matter, in which politics matter, in which relationship between different power group matter. And again, I think the fascinating aspect of my work is to kind of entangle and explore those relationships.
And again, just very clear parallels with the ongoing sort of battles of rights of women and sex workers for sort of health equity and recognition of their rights. Still actually something that's not been resolved. But the thing that sort of makes me...
Let alone funding. I mean... We don't record. Oh, sorry. No, I mustn't get it. No. We don't record how much money we spend on researching menopause in the UK because we don't spend enough to write it down.
Yeah.
Sorry,
Yeah,
we
yeah,
digress.
yeah, no, yeah. But something else we talked about we had an episode about menopause.
Yeah, which is
So,
a great episode.
which is a
Do
fantastic.
check it out.
It's one of my favorite episodes, actually.
Sorry, I didn't mean, but yes.
No, but the thing that it sort of reminded me of actually is that if we're thinking about and talking about public health, a lot of the times our challenge, or a challenge that remains, is that we think and punish individual actors and individual choices for things that are environmentally constituted or politically structured. And I wondered if you had any other stories that would sort of maybe tell the story. And this is a completely random question that's not on the cards. This would usually be edited out.
We're off script.
When I go off script, and we'll edit that. But it's harder to in front of a live audience, so we'll see. But other stories of how, I suppose, of these positive stories of resistance, I guess. So like, we started talking about Josephine Barker, but like other ones where actually you've got these sort of individuals sort of emerging, trying to sort of, hey, it's not me, actually. This is not about my individual choice. This is about the world that I live in, the way that it's structured. Like my inability to act or to be healthy is not about me or the choices I make, but about the society around. Is there anything you've come across in your histories that could be a story to remind us that?
Well, one that immediately comes obvious to mind is activism during the HIV in the 1980s and 1990s. That's a story of individuals that are excluded, they are stigmatized, that use their voice to voice a problem.
Yeah.
And this story is not just and that brings me to what I was saying at the beginning. It's not just about medicine. Yeah. So when we talk about public health, we're talking about health, but is there anything more political than our health and discussion around health? That's where you get all of those groups, often with positions that tend to be a little bit in tension with each other. Yeah. But you find those stories that are, yes, of resistance, but the resistance is designed to lead to a change or to move the discussion forward. So yes, activism in 1980s Europe or US for HIV is one example, but we can see plenty of examples of social change all across the history of public health.
So are you saying that, and as the hippie in the room, are you saying that social change is necessary for good public health?
I think change
and activism.
I think I think it is. I think it's important to have a voice, but I also think we need to frame those type of debate as something that is not static, something that is dynamic, is moving. Situations are changing, and very often, and that's the history of pandemics. Is something that teaches us very, very well that what was happening 1 month ago, it may be necessarily different what's happening now. So we need to have this kind of continuing reappraisal between the different and discussion between different stakeholders. And of course, as an historian, I have the privilege to take a look at events that are now done and dusted in the past. So it's easy to make this argument when, something that is unfolding in the present, I do agree, is much more complex to unveil. But I like to believe that tension are important and very useful for, having at least a discussion moving forward, if not the research or the kind of planning.
And I always feel, Rochelle, like Rochelle always says that she's the hippie, which I always feel like I don't have enough hair to be a real hippie. But I have some, I feel like I'm hippie adjacent, maybe. But I do think what you're drawing attention to is so valuable, because public health has a self-evident goodness to it. That saving lives, improving health, progress, modernity, these things just seem self-evidently good, along with the tools that develop to do it. So all the mass technologies of information collecting and analysis and the way that we manage the public health infrastructure, again, just feels like, of course, sewage is good. And we have these wins. Vaccination has been a success. Bazalgette's sewage system is still functioning now. So that's great. And somehow that just gets smoothed into a story of goodness and progress and certainty, which is very reassuring. But we have Palantir running the NHS, data collection and information management system at the moment. We have huge tech companies gathering vast quantities of information about all of us. Literally, we pay them to strip mine us for money and use our data. We have insurance companies who will reduce your premiums if you wear wearable tech so that they can surveil every aspect of your sleep, your movement, your heart rate, and so on. And these things have, because they come with a halo of health, it always feels to me like they have this sort of niceness that we tell this story of the Victorians sorted it all out, fixed the sewers, figured out the vaccines, Jon Snow pulled the handle off the pump in Broad Street, and we're away, it's all great. And instead, the questions that you've been posing, the stories you've been telling, have been about who is excluded, who is not included, what technologies of coercion and power are involved, which seems so part of disrupting public health. It feels to me is going, we can't just tell a rosy story that this is all great and everyone's lovely and it's all brilliant.
But this is why I think history is so important, because history is messy, history is dynamic, history is hard. And we don't like to sit with history because it's so hard and because bad things happened and it makes us uncomfortable to talk about it. And so I think that for me, the reason I sort of asked that question is sort of to remind us that, like, we've always been resisting. Like, we've always been, that is the most natural thing that we do as people, is to resist and to demand better and to change. And I think we forget that. Those aren't part of the stories we tell. And it's not, but it is how we got here. It's why we're all here, through resistance, and it's, I think it's a part of the story of public health we should be much prouder of, I think, for me. So I'm really, really grateful to have been able to listen to these stories today. It's been
it's great,
fantastic. Do you think this is?
Should we do questions? Let's do questions.
We can open things up to our audience who have come all the way here to be
the
with
Chadwick fans.
Anybody have any questions for about anything?
And please do, we'd love to take questions. I mean, Cristiano, I think, could answer a question on almost any topic in the whole history of medicine. You've got someone we can go back a couple of thousand years. So, do put him to the test.
Thank you so much. That was so interesting. And I've got a question about the role of misinformation, especially since you're emphasizing the importance of voices. And we live in an era where some people are better off just not being heard. Like, I'd rather they don't have a microphone. So what about the role of misinformation in the history of public medicine? Even misinformation by the standards of those days. Like, what was that like?
Okay, now, misinformation it's nothing new. And now we just see them everywhere because we have a tool to spread them very fast. But we actually have, if we focus on the Victorian period, but we can go up to the 14th century and the bubonic plague. We know that we have people that come up with any sort of remedy that is outside learned medicine at the time. But let's say 1 second in the Victorian period, and let's talk about vaccination, which is a place where we can see a lot of misinformation. There is a periodical called the Vaccination Enquirer. It's created by a religious figure to convey all of those voices through articles. So we have in this journal people that are against vaccination, but they are also against each other. So when you look at this material, it's very difficult not only to navigate the information and the misinformation you find there, but also to be able to understand how they can coexist. So to answer your question, there is nothing new. We have a long history of misinformation. We also have a long history of debunking misinformation, because in the 19th century, we already have doctor that take a stance and start telling the public what to believe and what to buy when it comes to medical product you can find on the public street. So there is plenty in those stories. So it's we have a very long trajectory that but sometimes I feel like, especially in the way we discuss misinformation now, it's framed as a new phenomenon. It's not. It's long. We can learn a lot about this. And I think it's part, again, on the way those debate exist across the past few centuries. But thank you so much for your question.
I feel much more relaxed thinking, oh yeah, people have always done the misinformation. That's such a nice, like the historical view. I'm like, oh, that's great. That's okay. It's not new. It's okay. We've got this far.
People are always going to people.
Yeah, so thanks. I think the whole discussion was really rich about unheard voices, but I'm interested in the dominance of the West, or whatever you want to call it. So you've been talking about people like Jenner, Snow. You did mention that inoculation came from Turkey, but what about all the discoveries around the world? And how have they been silenced, or what's happened to them? Why are we forcing vaccination on Indian people that has been developed here, for example?
Okay, that's a very big question, so I'm gonna try to answer this, and to do that I will rely on the fantastic work that is done by other historians. I'm an historian on medicine in modern Europe, so that's where I tend to kind of focus my attention. But you are absolutely right. Is actually when we talk about the practice of inoculation, we know that the practice of inoculation, of course, they came into UK through Turkey from Istanbul, but is a practice that is already done in other parts of the world. We know that, for instance, when it comes to medical practice, materia medica, there is plenty that is done in other parts of the world that we don't research enough. I think the question is on two levels. One, it's about we have a very long trajectory on focusing on the West. We are now changing that. There is a lot more work that is done in global history. There's a lot of work that is done in colonial history of medicine. I have a lot of brilliant colleagues that really work on try to unveil those type of tension. And exactly the point you were making, how those type of technique, legislation, approach were very often forcefully implemented on people in the colony. For what reason? Is medicine a tool used for domination? So plenty of work has been done there.
And that is such a structural issue. If you think back to the early 2000s, the bird flu outbreak, the Indonesia, where the outbreak began, had sent blood samples to the WHO, which we used to develop the vaccines. And the vaccines were made by for-profit Western pharmaceutical companies. And because of the deals that the Western governments have for priority vaccines were only needed in Indonesia. And all the vaccines went to Western countries who had deals to say, well, if it goes any further, we need the stockpile, so none of it can go into Indonesia. So you have a product made with literal Indonesian blood that cannot be made without Indonesians, and the Indonesians did not benefit from this financially or in any other way. So you have this extraordinarily structural, deliberate exclusion by the world's most, by every single structure in public health, like by the vaccine apparatus. So we have it's not, again, like not to be that, vaccines are great, but, we can't pretend these things are not, Rochelle's point that there are a lot, everyone's got some purpose.
Everyone's got a different project, and the sort of political, economic project of this production is one that leads to the violation of a lot of people and rights and exclusion of others. It just sort of made me think a little bit about the 2014 Ebola outbreak. So not this current one, which is not very good, but the last one that was the worst one, and how sort of local communities had their own sort of practices of like screening and protection and burial and sort of public health practices that were completely rolled over by the sort of external forces once they came in to manage the situation. And Paul Richards wrote this amazing anthropology about sort of that story of Ebola and sort of the erasure of local knowledge and replacing local knowledge with form. And when that transition happened with huge consequences for loss of life. And there really is this need to come back to this triangle of projects to really think about how we work to really create a chance for equality in knowledge systems, because it's this inequality in knowledge system that limits us from learning from each other, and I think slows down all of these processes of expansion and improvement. So there was one question here.
So I'm American, US American, and I have concerns about immigration and people opting out of vaccines because of political reasons. They're not in the circle because they're afraid to expose themselves. And so they're not taking advantage of public health because of a political position that they have risk in. So is there much research that you can share that the presence of people who may not have political relevance here from an immigration perspective actually do get the health and the public health benefit, while they may be in violation of an immigration, where the government has actually taken a public health stance rather than the immigration stance? Or is there lessons in history?
I mean, my brief experience was working for an NGO called Médecins du Monde, Doctors of the World, who set up projects first in Paris and then in Tower Hamlets to provide access to migrants, sex workers, people who did not want to avail themselves of the NHS service. And you know, with the story we would tell in the UK is free at the point of access, healthcare available to everyone. It's absolutely not the case. So I can't, this was a few years ago, but I cannot imagine things have improved. So I think this is a massive public health problem to say, oh, we've got this, all you have to do is go to your GP and you get a jab for free. Well, who cannot go to their GP? It's not, apart from all the problems of working hours and so all the regular difficulties. You're absolutely right. So I don't know. I mean, it's definitely a problem, and I thought it was one of the best things. This was a global medical charity, but the point they were making was we have the same problems in the UK that we see around the world. So we can't have a sort of us and them attitude of sort of here we're doing it all right, we're exporting care. You know, we have problems here as well.
Cristiano, do you have any reflections or things to add to that question?
Well, I cannot talk about the present because I'm not, I don't have an expertise on that. But in terms of exclusion, that's unfortunately part of many history of medicine in the past, many episodes. We always have a community that from one way or another, they tend to be either excluded, they tend to be silenced, they tend to be put aside. We also see, and I try to bring up some of those stories today, so Josephine Butler is one of them, but we have voices to trying to rectify or give, power to community that otherwise they are isolated by rule and regulation. So I think that from what I can see in the past is that, yes, very often this is unfortunately evidence we can find in many public health moment, but also, and I think it's a kind of a positive note, this kind of resistance, this kind of going against the grain, this kind of having people that use their own voice to push for include others, give this kind of positive twist. Nothing has been resolved in the present, as we just say, but it's good to see that attempts were made in the past.
I think that's a really good question. And I guess to me, it just makes me think a bit about the necessity of thinking about public health work as activist work. So like work to change the political circumstances that put people at risk is public health work. Because how can you achieve sort of, herd immunity without, if you've got people who are constantly living at the margins and who are always exposed. So that must go hand in hand with all the other things that we're doing. And I guess through history, it seems that it always has. So we just have to keep doing what we've always been doing. One day, everyone will be equal. That will be nice.
I think public health does have this status quo quality. It relies on institutions, and the people who will change it will be some of the young people in the room today who do not go into public health. And there are people who change the world and make it much better who do not necessarily work in public health, but who see who can be the grassroots activism counts for so much and is so valuable.
Yeah. I also like that Chadwick wasn't a doctor. I like that you put that in there. I didn't know that, and I think that's such an important thing to sort of bolster non-medical doctor me. See, Mom, it was okay.
That's good. That's good. We should say Rochelle's mum is actually in the audience, bitterly regretting Rochelle's career choice.
No, she's not. Not anymore.
At all.
Not anymore.
Can we do the last question?
Let's do the last question.
So look, we're interested in disrupting thinking everywhere, not just public health. So we always ask our guests the same question. And I should say, over the last 6 years, this has been an accumulation of wisdom and kind of esoterica and fascinating things. And I think it's a nerve-wracking question for our guests. We ask, what is a piece of art or music or poetry that has disrupted your perspective? We thought for this, because it's a special episode, we thought we'd do it. Cristiano, do you want me to go first? Or?
Please,
okay.
By all means.
The context for this quote, and I hope it won't be embarrassing for me to read. My younger brother phoned me a few days ago and he said, I cry much more as I've got older. He's only a little bit younger than me. And he said, I had to thank some people at work, and I couldn't do it because I was going to cry, and they got really embarrassed. And then he said he received an award, and he said he started to weep, and it wasn't a particularly big award. And I said, oh, exactly the same things happened to me. And I'd found this quote when I was doing some writing about longevity. And I came to tell it again to my wife, and I found that it just gave me the biggest lump in my throat. and so I'll try and read it to you, but it's from the oldest work of literature in the world, we believe, the Epic of Gilgamesh. And Gilgamesh, he's a king, and his friend dies, and he is terrified of death, and he goes on a quest to try and discover immortality and see how he can avoid death. And he gets to the edge of the world, and he meets an innkeeper who's also a goddess, Siduri. And she asks him, what's he doing? And he says, oh, my friend's died. I want to live forever. And she gives him this bit of wisdom, which I really love. And I know that I'm not going to be able to get through it without getting a lump in my throat. So you just have to not be embarrassed for me. So Siduri says, Gilgamesh, where are you hurrying to? You will never find the life for which you are looking. When the gods created man, they allotted to him death, but life they retained in their own keeping. As for you, Gilgamesh, and this is her advice for life. She says, fill your belly with good things. She says, fill your belly with good things, day and night and day. Dance and be merry, feast and rejoice. Let your clothes be fresh. Bathe yourself in water. Cherish the little child that holds your hand. I have a 2-year-old who holds my hand. It's amazing, isn't it? It's not a sad quote at all. But there's something about my son holding my hand that I can never get over. So she says, cherish the little child that holds your hand, and make your wife happy in your embrace, for this too is the lot of man. And I don't know what I don't. It's not like it makes me feel sad or overwhelmed, but there is something about that presentness of her advice. She's a goddess innkeeper at the edge of the world. I kind of love this. And he basically goes to a pub, and the bartender's like, look, mate, be nice to your wife, and be nice to your kids. Wear some clean clothes and have a bath is pretty much the advice.
Eat some good food, drink some good wine.
And this is why I've never written any epic literature, is that, when I say it like that, it doesn't bring tears to your eyes. But the little child that holds your hand, I feel like that moment of presentness and loveliness is sort of the detailed care that maybe we do think about in public health, and the immediacy of the people we love, and that care we have to extend to people, rather than a sort of a quest for some long life or something that a tech company or some supplement company or some weird clinic wants to extend us to and take our money for. So that's, anyway, the Epic of Gilgamesh. There we go. That's my one. Sorry, I just don't know when I've read it a few times. I can't get through it. Anyway, sorry about that.
I get it. No, it's beautiful. There we go. I think it's really.
We'll do an episode on crying.
It's good for you. It really is.
It is. I feel better, even if everyone else feels embarrassed. Especially you. Sorry,
I'm not embarrassed. I cry.
Next time I'll do Bruce Springsteen.
I'll cry still. It doesn't matter. Cristiano, I will go last. You go next.
Now I really feel ashamed with my story.
No, you must.
Yours is so passionate.
Yeah.
So when I had to think about finding something that really disrupted my thinking, it pushed me back to when I was second year student. So we're talking about ages ago. I feel old now. So I was second year in Italy studying philosophy, and I come across this French philosopher called Voltaire. Now, Voltaire, it's one of those philosophers that really went against the grain. He criticized the state, criticized the church, criticized all of the other philosophers, and he wrote this book called Candide, or on optimism. So he's a critic of the belief at the time that it was possible to think about the most perfect world ever existed. And he said, it's all rubbish. The world is not that good. It's imperfect. And this kind of idea of going against the grain, or keeping institution in check, or keeping society in check, keeping other thinkers in check, politicians nowadays, doctors, people that have ideas similar to yours or different to yours. So keep them in an environment that is dynamic, prone to discussion, in which you bring an healthy dose of skepticism. It's something that really brought up, and I hope I use a little bit today, but I always try to use a little bit in my research or when I present my work.
I
love that. Great. That's so great.
That's really great.
And it's good. Everyone's got something on their reading list now.
Some Voltaire.
Once they've finished the Epic of Gilgamesh, you're straight into the vault. There's no let up. I hope you've got a John Grisham quote or something that's going to...
Well, I always do this right on the fly, so I can sort of feel the room or what we've been talking about, and then that will, because I just have been immersed in art my whole life, and music in particular. I was lucky to grow up in a house full of music. Thanks, Mum, and dancing. My mother is the best human, and I just want to say that out loud while she's here, so she knows how wonderful I think she is. But the thing I was going to talk about actually is a Bob Marley album, one not legend, as my husband and I have been talking about, but the Survivor album. It's the album that he produced and he sang at Zimbabwe's independence rally. So he's done all this music about sort of like Pan-Africanism and stuff. And there's this like, I used to listen to this album all the time, especially when I was pregnant with my first child, Theo. And we used it when he would get like sad and stuff. So we would always make Theo feel better by listening to Bob Marley. And I think the reason that I wanted to talk about that today is because this album is very much, there's a few songs on it where it tries to bring you into sort of, I guess, critical awareness about why resistance is important and the necessity of resistance and the importance of us all doing resistance together. And it's just really nice to listen to. And, you know, Bob Marley, I think, was a prophet in many ways, modern prophets, and, you know, made music that in a time where there was still segregation and like division that everybody could connect with and could love and sort of really feel that it changed them. So while you're reading this heavy stuff, you can put some Bob Marley on in the background.
I love that.
To try and get you through Voltaire. I don't know. I probably would need some Bob Marley.
I think Voltaire would have been a Bob Marley fan.
I think so. Well,
what a fantastic note to end on.
Thank you so much. Thank you to everyone for your wonderful contributions. So you have been listening to Public Health Disrupted. This episode was presented by me, Rochelle Burgess, and Xand van Tulleken. It was produced by UCL Health of the Public and edited by Annabelle Buckland at Decibel Creative. Our thanks again to today's guest, Dr. Cristiano Turbil.
As UCL marks 200 years of challenging convention, we are so proud to carry that spirit forward by imagining what public health could look like for the next 2 centuries. If you'd like to hear more conversations from UCL Health of the Public, make sure you're subscribed wherever you get your podcasts. Search for UCL Health of the Public to discover the latest news, events and research available to everyone. Thank you all so much for coming. Thank you for your questions. Thank you for your enthusiasm for Chadwick and public health.